Hello. Hello, everyone. Well, my name is Sergio, and I am very honored to stay here with you. Sorry for my English, but I think I will try to share with you some interesting aspects of this frontier between spirituality and medicine. I would like to tell to you, Gabriela, this is a privilege to everyone, and for me especially, to hear you this night. And I would like to continue to hear you singing all of night. Sure? Well, I would like to suggest to diminish the light to a better contrast, maybe. I suppose that I will have 1 hour or 4. 5 hours till midnight, more or less, yeah? Well, I would like to comment first that because of my parents, I could study and learn in terms of spirituality because of they love to do this during all of their lives. I am a doctor for the last 47 years, and physicist too during the last 25 years. And when I studied physics, it was because physics is the mother of the sciences. So I understood that I need to know about the laws of physics to understand the reality, not only the material reality, but especially the world and the spiritual world. But as we can stay here till midnight, I will have, let me see, 60 slides. 60 only to try to present something interesting to share with you and to provoke you to questions after this very humble and simple presentation. Maybe? So let me see. Okay. Here it's me. First of all, medicine and spirituality. This is a very nice picture from Rembrandt, trying to reproduce one specifically ambient in terms of surgical in those centuries before these times. Well, let me see. Because we are Spiritists, I would like to remember that we learn in terms of the Spiritist book, the hierarchy of words according to Spiritism. We are here, one word of trials and atonements, proofs and expiations, something like that. But we have a big future to the next millenniums, where each one of us and all this humanity, we will have the opportunity to, advance it, to obtain virtues, spiritual virtues, to our differentiation in terms of spiritual acquisitions to a better life, to a better situation in not only on earth, but in the big universe of God. But we have to obtain this one during many and many incredible time, but God has all the patience with us, and we need time to do this kind of evolution in moral, spiritual terms. But here on earth, it's okay? Yeah? So, let's go. Basic considerations. The same. Livia.
Three times.
Yeah. In terms of basic considerations, our word, humanity, this humanity, a collective of 22 billion morally deficient souls, brought together for re-education and regeneration in moral terms. We are here, everyone, we are here. 8 billion incarnated people like us. And so, during some differentiation, 14 billions in the other world. It's not the other world, thank you so much. This is the same word, because in another time, all of us, we are there. And in the future, all of us will stay in the spiritual world again during many and many, maybe decades, to do some kind of evolution that we cannot do here with one physical body as we have now. All of the different worlds, this is the same earth and the same family and the same humanity. It is interesting to us, working as a doctor, working as a health professional, to understand, and including as spiritualists and as spiritists, to consider the other life, the other side of life. Because our friends, our family, in a very different but true understanding, they are living there, and we need to take care of them. And in mediumistic meetings, we can stay with them in suffering process and help them, working in spiritist groups and centers around all the world, and here too. So this is one information from this book, from Emmanuel and Francisco Cândido Xavier. We need to do the inner reform and substitution of vices for virtues. This is the main idea, what we are doing here, where we come from, what is our destiny. This is the main aspect for everyone, including us, obviously. I would like to tell you that if I talk something that was difficult to understand, please, we can till midnight. Tomorrow no one will work. Yeah? Let's go. Medicine. In terms of medicine, que lindo que ele é, né? Que lindo. We have in this world medicine from 5,000 years. The first doctor, he was Egyptian, Imhotep. in specifically dynasty. He was very near in many aspects with the pharaoh of those times. So when we understand the history of the writing of the history of humanity, we can understand and we can see the same. The history of medicine is the same time of the history of humanity. Because this is a hospital. The earth, this is a school, a basic school in moral terms. But it is a big hospital of souls. And they are what we are. And we have this opportunity to live on earth and try with dedication to obtain the virtues and to distinguish what we need to do and what we don't need to do. Every day, every hour, we need to care of ourselves in these terms. So, in medicine today, we have physical and mental illnesses. Illness. Sure, you know this. We have cancer, we have neurological problems, we have cardiovascular problems, acute myocardial infarction, cardiac failure, we have rheumatological problems, we have virus, we have bacteria, we have many and many different diseases. But we have autism, we have depression, anxiety, schizophrenia. We have many and many aspects to understand, to study, to care, to receive in our clinic and in the Spirit Center too. Because one of the main aspects of each one of the Spirit Society around the world is to care. Well, one comment, old and new diseases, diabetes, hypertension, old diseases, but Ebola, 19 COVID, those are new one because of different virus in terms that we can see in the humanity. But we have many aspects to discuss about this. We have congenital and acquired, old and new diseases. Medicine of the body, even in mental illnesses. For example, depression, it's a pandemic in all of the countries around the world. Anxiety too, generalized anxiety. In the United States, in Brazil, em Puerto Rico, donde sea. Então, é o hábito. Sorry. So, when we study depression, we can see some brain differentiation in the anatomy and the structure in the brain. But those aspects, they are consequences of the spiritual problems that we have in all of the different kind of diseases that we have around the world. Do you understand? Many colleagues in psychiatry, they understand that they find the true causes of depression because of the differences in magnetic resonance of the brain of the depressive people. But no, this is only one material aspect, consequences of the spiritual reality of each one of our patients. we have not only medicine, we have medicines, allopathic, homeopathic medicine, and various alternatives, traditional Chinese, Ayurvedic, acupuncture, and many others. Because in all the societies, in all of the countries, during all the history of the humanity, we have patients suffering, and the groups always trying to discover, to understand why so much difficulties in their societies. So all of that medicines, they are fine, they are beautiful, and we can, as a doctor, to study all of that. Well, I would like to share with you this idea. We are understanding that we have now one historical moment in medicine. Why? Because we have the progress law. All of the sciences and all of the human aspects of the society, the understanding of life, we are obtaining in different times some upgrades to understand and to care of our patients. But now we will deal with the idea of some kind of spiritualization of medicine. And this is science. Medicine is a science. Modern physics, general physics, this is a science. And Spiritism is a science. So, in addition to the humanization of contemporary medical activity that the world is so desperately needs, it's necessary spiritualization is based on increasingly notable scientific evidence. My colleagues, independently in which country, if they study the idea of religiosity, spirituality in medicine, they will need to do, because this is one upgrade in medical science. Because we are all spirits, the patients, the doctors, and the health professionals. Spirits, sons of God, with the same kind of necessities. What we can see this is the title of one paper in medicine, all in a scientific approach. Religiosity, spirituality. You need to remember this. You will see this to the next decades when you study medical problems, diseases, illnesses, and so on, as a medical prescription. This is very important. Do you understand when your doctors, your medical doctors, trying to help you when you are sick, independently of the very beautiful, modern, and nice development in science, your doctors would like to know what kind of belief do you have, because they will suggest, independently of drugs, of medicines, they will prescribe spiritual activities to each one of you in the future. But this is nice. We are here in the last year, November. Let's go. If I enter, this is interesting too, the best site in medicine all over the world, it is the United States of America, related to the CDC, Atlanta, Georgia. The NIH, and inside the site of the NIH, we have the PubMed, of publications in medicine, abstracts, research in medicine from all of the medical groups of the world. In the last week, if I put here the idea of spirituality, we have so much different research talking about spirituality and medicine. This is not one idea of the Spiritists. This is scientific medicine. And you can see the big difference between those days and the old time. There's an exponential growing of the number of papers. And this is fine to us. This is the present, and this will be the future for many and many different centuries. If I put, let me see. Religion, spirituality.
Yes.
Yeah. We can have many and many abstracts and research, the same, an exponential from the old decades. So this is science. Your doctors, your health professionals, they will have to study this. For example, I am a cardiologist, and I try to prevent cardiac surgery of my patients, treating of them clinically. Do you understand? But I have cardiovascular surgeons, 3 that I recommend, I ask for they open the chest of my patients. And all of my patients, I stay there in the surgical environment. So all of them, the 3 experienced cardiovascular surgeons, they do not begin one cardiovascular surgery before they do a prayer. Before the anesthesiologist to put the patient in the comatose stage, when the patient, they are awakened. Because all of the team of the surgical situation, they stay with the surgeon and me too, doing a prayer to the good result of that surgery. And all of the 3 cardiovascular surgeons, they are not spiritists. Each one, they have some understanding in terms of religiosity, spirituality. And this is very interesting because it's difficult to see one surgical complication when we have this care in spiritual terms to each one of the patients being submitted to cardiovascular surgery. And this is not one group here the same. The same independently of the country, of the culture, because it is spreading to the word. The same. Here, one American paper in this Annals of Internal Medicine, the best in the United States of America, one of the best. The efficacy of distant healing, one systematic of randomized trials. This is a new understanding of the possibilities to help the people around the world. We can stay in the United States of America, maybe in a church, maybe in a spirit center, maybe in a familiar group of faith. We can project magnetism and fluids to benefit all kind of people with some medical problem. And this paper, this group in America, trying to put in evidence the good results when we do this. The best one, the New England Journal of Medicine. God at the bedside. This is a medicine paper. God at the bedside. This is one invitation in the direction of the religiosity and spirituality and medicine. And this kind of research, because of Annals of Internal Medicine, New England Journal of Medicine, they are in all of the world, hospitals, science group in medicine, because of the spreading of this kind of nice information. All of the people around the world, they are waiting for more and more papers and contribution from many different groups of doctors around the world. Here, the same. Should physicians prescribe religious activities? Yes. The best in Europe, from United Kingdom, The Lancet, Religion, Spirituality, and Medicine. A triple frontier. Well, I don't know where I put this, but where I was, Baltimore, Maryland, in a spirit group with friends from here, bridging spirituality and medicine, a 40 years experience. But Buenos Aires, Milano, Varsovia, Poland, main city, Austin, Texas, the same. Why this first slide in a seminar or a study? Because this is the common invitation to study these aspects of relationship between science and spirituality. Do you imagine me talking in Polish? Sure. My mother is Polish, Poland. It comes from Poland. So, Varsovia here. Spirituality, this is one of the some definitions. What is spirituality in scientific idea or understanding? A set of moral, mental, and emotional values that guide thoughts, behaviors, and attitudes in the circumstances of intra- and interpersonal relationship. This is one idea to our reflection, consideration in time. I would like to tell to you that this material, this PowerPoint may stay with you if you want to do another analysis of these contents. Paradigms in medicine. Till now, we have the materialistic, the first one that persists just now, including Cartesian mechanicists, but we are changing to a different model, the spiritualist paradigm. Religiosity, spirituality. This is with medicine and will be with us forever. Psychoneuroimmunoendocrinology. This is one. Yeah, sorry, but this. Yeah. This is one modern specialization in medicine because of the relationship with the psychic condition, the soul, because we understand that each one of the patients, they have physical body, they have perispirit, but they are souls or spirits. Psychoneuro, because the relationship in the soul, the brain, the mind, the thoughts, with the central nervous system, the brain, and the immunological aspects of the biology of the human beings against virus, bacteria, and many other aspects. When I have one cell division with some kind of anomaly, if my or yours immune system don't destroy this double cell condition, we will have a tumor, a cancer in 6 or 8 months, no problem. So we need to do this kind of relationships. This is a seminar to study maybe in the future. So we need to study in the same idea of spiritualist paradigms, mind, body, spirit, matter, the relationship between them. Well, some idea about the invaluable contribution of Spiritism to medicine. Medicine enlightened by Spiritism. Why? He would like to study with us. Yeah? Demonstrating the existence of the soul and its antecedent to reincarnation, Spiritism, allows us to locate the origin of many diseases in its complex structure and inaugurates several therapeutic modalities. This is a very simple and important idea in this frontier. It partakes of the nature of two distinct words that interpenetrate and interact with each other. Each one of our patients, the human beings, we are here incarnated once, but all of the days at night we are in the spiritual environment. And the spirits, the discarnated ones, they stay with us all times, living with us in a very different occasions during our days and nights. The human beings and the triple structure, physical body, perispirit, and human soul. Therapeutics aimed at the spirit and its perispiritual matrix. This is a change. This is a big change from now to the future because of the light of the Spiritism offering a different understanding about our situation as human beings in this world, the earth. This is a reflection from now. Radiation physics, transcendent electromagnetism, fluid chemistry, psychic powers of doctors, and spiritualized therapies. This is a seminar too, because we can examine each one of these aspects. In psychiatry, psychology, and psychoanalysis, recognition of the human soul as the seat of life and the origin of all mental disorders. Definitive incorporation of the idea of reincarnation and the pending karmic aspects. I can talk about this in terms of the science of the afterlife. A seminar too, maybe in the next reincarnation. Obsession and spiritual influences. Here, this is a main aspect of life, including the life of the patients treated with those, each one of these three sciences. Imbalances of a mediumistic nature. How to prevent disease in general. Inner reform and educating feelings. Cultivation of the virtues of the soul, altruism, peacemaking, solidarity, fraternity, disinterested charity, and ability to forgive. Science. Work. This is a kind of internal work to change what we have inside us. Work to know about ourselves and to change what we need to change. Prayer and bond with the higher spiritual life. Spiritualization of life. Everything. We can put something better, something more in terms of what we are doing during our lives and every day and every night. Every night in the spiritual world, when we are at night sharing beautiful aspects during the nights, because we can share, we can find our family members from the past in many generations, friends. We can study, we can do many things to our moral advancement in this important 6 or 8 hours during each one of the days, nights. Spiritualization of life. We need to understand and to spread the idea what we are doing here. What is the purpose of the existence? The Spiritists in this world, they are 0.0007% of the humanity. We are a grain of sand in a beach. Only this. So we need to share. We need to stay together. We need to study Spiritism and all of the science that can or could help us to obtain a better understanding of the purpose of this existence. Knowledge and fulfillment of divine laws. We need to know, but we need to put those ideas inside us. Well, may I share this? Midnight and a half. I would like to share one interesting that I suppose this morning, and I put in the presentation. Spirit Science in Psychiatry Congress. 16 years ago, a psychiatrist from Argentina, La Rioja, suggests to me, when he visits Rio de Janeiro, our Spirit Society, because we combined to care of one very severe case of one patient of Dr. Sabino Luna from Argentina. And then when he understand what we are doing, he stayed very sensitive. And especially when Christian, the patient, becomes completely better after one approach in this idea of spirituality, medicine, mediumship, magnetism, and other interesting aspects. And then he looked in the computer the next World Congress related of mental diseases. And the next one, the 5th World Congress of Psychotherapy, just in Beijing, China. So I needed to go to Beijing. Rio, São Paulo, New York, Narita, Japan, Beijing. And I stayed more or less 5 days because I needed to come back home because my wife, she was pregnant in the 9th month. Many histories about this aspect. Beijing, China. This one I present to 2,000 psychiatry and psychotherapists sharing this meeting in Beijing from 100 of countries around the world. I am this one. Allan Kardec, Spirit Society. This is the main slide. Spiritual approach of mental diseases. Do you know this? If you visit Rio, I will be there. Okay? We can visit all the beautiful scenarios that we have in that city. National Institute of Health, where I was working, Rio, Beijing, 2008. Spiritual approach, background. The incidence and prevalence of mental diseases are growing throughout the world, and their causes are not yet clearly established, in spite of the recent advances in modern psychiatry. And the therapeutic outcomes are disappointing in many cases. This is one introduction. The methods. Patients, we study 36 cases of variable mental diseases that fulfill diagnosis criteria that looked for spiritual healing in a center of spiritual treatment in Rio from January to March during 3 years. Diagnosis of those patients: depression, panic syndrome, schizophrenia, autism, bipolar disease. Techniques. By using mediumistic techniques or the human ability to enter spiritual reality in an objective and clear manner, we have come into contact with spirits and spiritual contexts in the spiritual world linked with each patient that have a well-defined disturbed situation. Can you imagine the look, the face of my colleagues? Many of them, they do not understand what kind of doctor talking about those aspects. So I have many friends from that meeting till now. We can see them, the spirits, and talk to them very clearly through the mediums. Fraternal dialogue. The diagnostic approach to understanding the spiritual aspects of each case happened with the aid of a team of doctors, mediums, and spiritual treatment centers. In all cases, the spirits were of human beings who had lived their lives such as we live ours. They were now in a spiritual reality that is a world parallel to ours. They interfered psychically in the lives of the patients, causing harm and maintaining the symptoms of specific mental diseases. The ties between these spirits and the patients were established in previous lives and old reincarnations. In a non-controlled prospective study of 36 patients with the mental disease mentioned above, by using mediumistic sensitivity or mediumship, we were able to see and to receive those spirits to act in a psychotherapeutic manner, such that we were able to undo the spiritual ties in each one case of each one patient. This is the disobsession. But I understood that I needed to talk about, because they don't know nothing about this. They stayed very surprised. And I stayed till midnight with them. I tried to go out, open the door. No, doctor, please. Yes. This resulted in an evident improvement of a significant percentage of the cases, 86, and even resulted in a complete and sustained recovery of mental health of many of them. This is the table: depression, panic, schizophrenia, autism, bipolar. The number of cases, the clear benefit, no clear benefit, and cure. Spiritism, mediumistic approach. Mediums working with the good spirits, trying to benefit each one of that patients. Spiritual approach of mental disease results according to diagnosis. Allan Kardec and the Spirit's book, to them, what spiritism? So I put the image of the codifier and the main book to introduce my colleagues to one kind of interest, to know how you can tell us about this kind of approach. Centers, to them, centers for spiritual treatment, 10,000 centers in Brazil, complementary treatment to classic medicine, Spiritist hospitals. The mediums and collaborative team are doctors and common people interested in the well-being of humanity and the suffering. Physicians trained in spiritual healing. How are the mediumistic meetings? 6 to 12 mediums around the table, individualized attention without the presence of the patients. Name what we need to open each one of the cases. Name, complete, age and address is all what we need. Witnessing the spiritual word and verbal manifestations of the spirits related to the case. Spiritist rescue, treatment, and guiding to a better environment and spiritual sphere of life in the spiritual realm. Presentation of the codifier. Allan Kardec, a French educator from the Pestalozzi Institute of Yverdon-les-Bains in Swiss, worked to put all important revelations about the spiritualization of human life in Western world from his contact with the spirits through the mediumship of his collaborative team in the Spirits book. This was one nice image of Allan Kardec and those colleagues during a specific meeting, only to put one idea of one mediumistic meeting. Reincarnation, immortality, divine paternity, development of virtues of soul and moral values, communicability with the spirits and their influence in our lives, spiritual treatment when necessary, the importance of meditation, the value of prayer, the existence of the spiritual world, near and beyond us. Voluntary, this is important to them, free of charge. Voluntary participation of all participants and administrators, because they asked to me about the price to do this approach, and they stay very surprised with the answer. To them, Spiritism, it is the collection of principles and laws as revealed by superior spirits contained in the works of Allan Kardec. Here, two of them. Now, this is the more recent book, the third edition from this Harold Koenig, one of the best specialists in this frontier. Religion and Health, the name of the book. This is a book with so many pages. And then, what does the best research show about the impact of religiosity and spirituality on health? Summary of thousands of the best research analyzed in the third edition by him, Classic Handbook of Religion and Health, which has just been published, by Oxford University Press. I stay all this night to read the book, but only one superficial reading.
Last night?
That's right.
The whole night? Oh my goodness.
This is a resume. I stay sleeping in the morning till the hora do almoço? Lunchtime, thank you. And then sleeping, but I would like to share with you some kind of evidence, some conclusions. Stronger evidence. We work in medicine with evidences because we do not have proofs, definitive aspects. We need to go slowly but with the main understanding about the research in this area, in all of the areas, in science, in human science, stronger evidence, lower levels of depression, suicide, use of alcohol and other drugs, diminishing general mortality, and increased well-being and existential sense. When the people share in the church, in a spiritual society, in religious groups, independently, maybe the synagogue by the Jewish people, independently of the kind of church. Social impacts, greater social support, family and marital stability, lower crime. What we need, what we want, what kind of objectives that we have when we analyze science to help the humanity. And this is medicine. Religiosity, spirituality in medicine. This is the evidence. Better habits when emphasizing valuing the body. Less use of legal or illicit drugs. Better nutrition and more physical activity. Sharing spiritual aspects. Many challenges for future research. Challenges for the future. What are the mechanisms through which it impacts health, and more studies on the best ways to apply it in the clinician or clinic in an ethical and more effective way. This is the challenge that we need to live in the future, based in the information that we have, for example, put those in this book. Midnight and I was 2019 in Lisbon in the World Congress of Psychiatry, the best congress in psychiatry specialists all over the world. 6,000 colleagues from every one of the countries around the world. They accept 2 papers, 2 contributions from our Spiritist groups. Again. So when I was in Lisbon, I was informed that we will have International Congress of Spirituality and Psychiatry, specifically in Jerusalem, in the same year, but in December. And I take a flight and stay there during 1 week. My wife, he was not pregnant.
She was not.
Yeah, she was not. O que eu falei? Oh, I'm sorry. I'm so sorry. When I received the confirmation, it is the pleasure of the International Scientific Committee of International Congress of Spirituality and Psychiatry, Jerusalem. The 4 organized by the more important group of science in psychiatry. So, to accept both of your abstracts entitled The Influence of Discarnated People in Autism Spectrum Disorder Patients and the Benefits of Psychotherapy Approach to Them, and Influences of Discarnated People in Mental Disease and its Respective Approach for Oral. One by one more simple presentation, a poster, and this one more general aspect in psychiatry for oral presentation. They give me a half hour. So I present so fast. This is one idea to us because we are dealing with patients from all over the world during 25 years with autism and autism spectrum disorder. Here, Atlanta, Georgia, this is the last presentation in statistics about autism. Can you see this? I am waiting to that this year, 2024, but I will see 29, 31 maybe, and we don't know the future. And autism spectrum disorder, this is a very important study to us in psychiatry, in medicine, and as spiritists. This is an issue, a matter to a next presentation, maybe tomorrow. I am here.
I'll be here.
Yeah. Here, the main slide in Jerusalem. Our spirit group and the title, the same. The Brazilian group from different cities from our country, Brazil. I think I am this one. Yeah. I think. The same, I come back from Jerusalem and I understand about one invitation to stay in United Nations to do one simple presentation about one very important drama, depression and suicide, in a medicine and a spiritualist view, introducing something about spiritism to our colleagues in this meeting. The idea was 1 hour presentation, 2 hours and a half, because many contents, and the doctors, they want to know more what kind of this. The same as the people, the colleagues from Beijing, China. Medicine of the soul, Spiritist medicine, disobsession or assistance to the discarnated people. Fluid therapy or magnetism, evangelization and intimate reform, prevention, how we can do this one, and the main importance of the prayer. Spiritist fluid therapy in physical plane. All of them patients. Do you remember? Astral City? The same therapy in the spiritual world. Do you remember? André Luiz, no? Basis of, I am finishing. I can feel your mind.
I was just gonna do this and you got it.
Yeah, I can. I know everything about you. So, this is interesting to us too. Some kind of resume. Basis of a spiritist medicine, valuing the knowledge and practice of the scientific, philosophical, ethical, and moral aspects of the spiritism or spiritist doctrine, valuing the soul, the perispirit, and the relationship with the physical body and in illness and health recovery. Valuing mediumship and the participation of the greater world in therapy, the good spirits, always with us, in the name of Jesus. Knowledge of humanity's human and spiritual reality. Appreciation of hostile spiritual influence and its appropriate approach. Obsession and disobsession. Appreciation of disobsession meetings and their dynamics. Appreciation of the Spiritist fluid therapy or magnetism. The doctrine of the spirits and evangelization, healing and prevention. Concluding, last year, Vienna, Austria, the same. Receiving the idea of both the submission abstract number, Sergio, the Congress of the best of the world, because of this association. Acception, poster sent to me about the guidelines. What the title? Spiritual approach of mental disease patients with different diagnoses with mediumship, disobsession, and fluid therapy in the title for the first time.
Yeah. It's amazing.
Opening doors. And here, detection of discarnate people related to the autism spectrum disorder patients and the benefits of the psychotherapeutic approach by mediumship. All of my colleagues, they don't know about this. One or two, but we need to stay with the seeds of this kind of understanding in terms of health, in terms of suffering. Just to finish, World Psychiatry Association position statement on religion and spirituality, research and clinical implications. Section, religion, spirituality, and psychiatry. This is in all of the world. This is a resume, the same of the statements. And to finish, religious ideas, far from losing anything, are magnified by going hand in hand with science. Allan Kardec in the main book that we need to know. Thank you so much, dear friends. Well. Thank you so much.